awarded to the Great Plains Tribal Chairman's Health Board by the National Center for Chronic Disease Prevention and Health Promotion in 2014, and that's a division of the Centers for Disease Control and Prevention. This cooperative agreement provides sub-awards to the 4 participating tribal communities: Lower Brule Sioux Tribe, Sisseton, Wahpeton, Oyate, Cheyenne River Sioux Tribe, and Flandreau Santee Sioux Tribe. This is a 3-year initiative to improve health and reduce the burden of chronic disease within tribal communities, and this cooperative agreement supports relevant Healthy People 2020 goals. So some short-term goals of GP Pitch include increased access to smoke-free or tobacco-free environments, increased access to environments with healthy food or beverage options, positive changes in attitudes, beliefs, and awareness, increase access to physical activity opportunities, and increase opportunities for chronic disease prevention and risk reduction through community and clinical linkages. Long-term outcomes of the program are reduced rates of death and disability due to diabetes, heart disease, and stroke. GP Pitch also supports the implementation of population-based strategies that expand the result and the health impact of the policy, systems, and environment improvements. I know most of you on the call this afternoon are aware of PSE changes, so I'm just going to talk briefly about it. I'm not going to spend a lot of time on it. Policy, systems, and environmental change strategies are public health interventions that make changes to existing policies, systematic practices, or environmental factors to improve the health of the overall communities. PSE changes are often interrelated. PSE approaches often make healthy choices easy and sustainable for communities, often making the healthy choice the default option and over time the social norm for the community. PSE aligns with many Great Plains tribes' cultural beliefs by creating systems that will provide healthy habits and knowledge for future generations, and the processes address the sacred hoop of life and interdependent relationships of the tribal environment in the communities. The ancestors of the Great Plains tribes had a multifaceted approach to tribal well-being and survival. By understanding their environment and their role in it, the Great Plains tribes were able to maintain good health for the community as a whole. PSE approaches and changes allow tribal leaders to continue those traditions in today's society by encouraging healthy and sustainable behaviors, lifestyles, and environments that will strengthen the foundation of health for tribal members and their families. So this is a cartoon that I just wanted to share. I love this cartoon and I think it perfectly describes PSE change. So we're looking at a family of fish here. And in the first square, the family has been given a fish, which is great, and it's a very nice charitable act, but this is not sustainable and doesn't help the family out in the long term. In the second block, you teach that family the fish, which is a great idea, and now they have the ability, and this is more sustainable. But in the last square, this pictures the PSE change, establishing a safe community use fishing ponds. So now this makes not only that they've been taught to fish, but they have a safe place to fish in their community, so that this will become the healthy and the social norm for this family. So let's talk a little bit about the policy, systems, and environment tool. The PSE tool is a community needs assessment that is culturally adapted and modeled after the CDC's Community Health Assessment and Group Evaluation Action Guide or tool. So it's also known as the Change tool. So utilizing the PSE-T will help the community measure community health in different sectors such as work site, school, and healthcare, create knowledge and awareness of a community's multiple strengths and possible areas of improvement or focus areas, and implement PSE strategies reflective of cultural values and the community's beliefs. We can talk a little bit about the development of the PSE tool and how it came about. In 2013, the Northern Plains Comprehensive Cancer Control Program, which is another program here at the Health Board, created a Policy, Systems, and Environment Task Force. This task force was put together to address chronic disease disparities in tribal communities, and they really wanted to use a comprehensive tool to review important PSE components that were already in place to promote health in the community. So they chose to pilot the CDC's Change Action Guide, or the Change Tool, over 8 months in multiple tribal communities in 5 different sectors. Ultimately, the Change Guide was culturally adapted to improve its process for future use specifically in tribal communities, and was renamed as the Policy, Systems, and Environment Tool, or PSET. The implementation of the PSET involves 4 different steps. So step 1, creating the Tribal Advisory Committee, or it's called TAC, or your coalition. Here you want to identify 7 to 12 individuals to sit on the TAC. The TAC is really the driving force of the GP Pitch program, and ideally each TAC member should have input and be involved in every step of the PSET. Each TAC should have representation, ideally from the settings described in the table that's on the slide under the GP Pitch settings. So someone from community, someone from faith-based organizations, and retail or healthcare systems. Like I said, the TAC, really, you want them to be involved in every step. So steps 2 through 4, all the way through. They'll be involved in defining the community, establishing a cutoff score, and implementation of community action plan activities. Before moving to step 2, you really want to sit down with your TAC and ask them why it's important to them to develop a community action plan. Why is this important for the community and the tribe? And hopefully this will create an important discussion to gain different perspectives from each members. With the help of the TAC, you go to step 2 and you identify and review data sources together. So data sources can include observations, conversations, stories shared, personal experiences, and review of protocols. It can also be review of policy manuals, community forums, interviews, and surveys. Non-Western means of knowledge, such as traditional knowledge, empirical knowledge, and revealed knowledge, are also included in the data sources. And I'll talk in a few minutes about these type of sources specifically. Step 3, for each setting, the program coordinator or the facilitator and the TAC will review and come to a consensus together about policy and environment ratings, which Whitney will talk a little bit about later on in the presentation. Step 4, finally, your last step for implementing the PSE tool is developing a community action plan, or CAP. The CAP is a powerful tool of common goals and visions from all your TAC members. So using the data from the PSE tool, create a CAP with the TAC members and choose culturally tailored PSE interventions that reflect the beliefs of the community and that will improve the overall health of your community members. A little bit more about a community action plan, or CAP for shorten. Your CAP is like your blueprint. They're going to outline the different details, such as what strategies are picked, who will benefit from the interventions, how they will be put in place, and when they will be put in place. So common elements of a CAP include your goals and objectives, your list of activities, your timeline, and when designing your CAP, it's important to have your CAP be action-oriented and have your objectives be SMART. So over on the side of this slide, SMART is broken down, but the more that you're able to make your objectives SMART, the easier it will be to put your CAP in place. So to break it down, specific, so who is this PSE strategy targeted for, and what is this strategy? What is this intervention that you want to do for your community? Measurable. What is the reach? So how many people will be affected? Is it a neighborhood? Is it a whole community? For example, pitch targets 75% of the community that the TAC defines. Achievable. Are these goals that your TAC wants to do, are they attainable? Realistic. Can these PSE strategies be implemented? Is the community ready for this change? Is it something that they'll be open to? And lastly, time phase. So what's the timeline of implementing the strategies? Is it 6 months? Is it 1 year? It's important to set a deadline to keep the activities on a timeline. There are 2 proposed timelines for the PSET, a 3-month timeline and a 6-month timeline. On the slide, we're looking at the 6-month timeline, and it really shows the breakdown of activities for each meeting, for each TAC meeting. So you essentially have your agenda right here, and the 3-month timeline does that as well. Although these are 2 proposed timelines, implementing the PSET really depends on multiple different things, and so the timeline really is going to vary, so it's hard to put it in a specific, how long will this take, or this will take 4 months, or this will take 6 months. A lot of things such as how involved your TAC members are, how long it takes to complete the interviews, how long it takes to develop the CAP, all come into play when implementing the PSE tool. In the beginning of the presentation, I talked a little bit about how the PSET was a culturally adapted version of the change tool, and these are some of the changes that the PSE task force did when developing the PSET. So the steps and the process of the tool has been condensed from 8 to 4 steps. So the change tool is originally 8 steps that the CDC developed, but the PSE tool is 4 steps. Examples were added for tobacco-free versus smoke-free policies to make it a little easier to understand. And additional space was provided for other things that the tribe may want to add or may want to talk about that might not be included in the assessment. And lastly, some of the culturally tailored information I talked about. Traditional knowledge, empirical knowledge, and revealed knowledge with step 2 with the data sources. So for the PSE tool, these 3 types of knowledge were incorporated to make it more culturally appropriate for implementing in tribal communities. Traditional knowledge is knowledge handed down through generations, through creation stories, origins of clans, and encounters between ancestors in the spirit world. This can also be based on history and experiences of the people to reinforce values and beliefs. Empirical knowledge is knowledge gained through careful observation from multi-vantage points over an extended period of time. And lastly, revealed knowledge is knowledge acquired through dreams, visions, and spiritual protocols. So we thought these non-Western means of knowledge were important to incorporate for the PSE tool. Next up, Whitney's going to talk about her experience in implementing the PSE tool in Lower Brule. All right. Can everybody hear me okay?
Yep, everything's fine, Whitney.
Okay. Hi, my name is Whitney Nordvold, like Eugene said, and I am the Lower Brule Program Coordinator for the Pitch program, and that's my name. So I want to start just a little bit, start out with just telling you guys a little bit about Lower Brule. I think a lot of you are from South Dakota, so you're familiar with many of the Native communities in our state, but I just wanted to give you an idea of some of the resources we have and some of the challenges that we face as a community to help you decide if you think this is a tool that would be useful to implement in your community. So Lower Brule's pretty small. It's just, it's on the west side of the river, right along the river, and it's like kind of central, sort of south of the central area of the state. And the total area of the reservation is, the total area of the town itself is less than a half square mile. And the whole reservation is over 132,000 acres. So it's a small reservation in comparison to some of the other reservations in the state. And it's pretty small population-wise also. So the Lower Brule community itself is just under 800. And we have 3,410 enrolled members in the tribe, and about 1,600 of them live on the reservation. So we have a lot of people that are, the community itself is considered rural, but about half the people who live in our community live out on home sites, ranches, farms, those kinds of things. Over 90% of the community is Native American. Lyman County the reservation takes up most of Lyman County, so it's kind of hard for us to find accurate data sometimes because there's a large non-Native population also in the county. So some of the stuff that I'll be sharing, just the basic informational points, cover the whole county and not just the tribe. But the Lower Brule, as far as some of the supports and resources we have in the community, we have a Head Start, an elementary school, middle school, and high school on the reservation. And then we have many students that commute to Lyman County School and to Chamberlain School, which are both, kids are probably on a bus maybe an hour to an hour and a half, hour and 45 minutes, depending on the weather, to get to one of those other schools. That's one way. Most of them are on the bus for at least an hour. And then we also have a community college right there in Lower Brule, the Lower Brule Community College, which is a great asset, and they contribute a lot to the community. So we really appreciate having them there. And then we have lots of supports for recreational activities. We have an elderly nutrition program and a teen center that is part of the Boys and Girls Club that's just getting back up and running. In some of the storms last summer, we lost our actual Boys and Girls Club center. And so that's in the process of getting back up and running also. We're right on the river, obviously, so we have recreational facilities that way. So those are some supports to physical activity that we have. We also have a community center that has a swimming pool, a basketball court, and an exercise room. And then in that facility, we have the diabetes program, and they do lots of physical activity and nutrition education throughout the community also. There are 4 grocery stores in Lyman County and 5 convenience stores, 2 fast food restaurants. But Lower Brule itself only has one very small grocery store. We have one convenience, like gas station sort of store, and then we have one sit-down restaurant that's in the casino. We have a couple people. We have Kay's, which we love. She's our local, our resident Asian gal who makes amazing Chinese food right out of her kitchen. So we have a couple folks that do those kinds of things. I just wanted to talk also about some of the challenges or some of the stepping stones that we've had to look at towards when we were moving towards deciding how we wanted to implement the PSE tool and what we were going to do with the results. So some of the challenges we have there, one is up until the implementation of no cap or evaluation plan that had anything to do with policy system environmental strategies existed in the Lower Brule community. Geography presents a significant barrier to accessing healthy foods for many of the residents in Lyman County, especially in Lower Brule. Like I said, we just have that one grocery store, so it doesn't really have any competition. So the prices are a little bit higher, and the healthier options like the fresh produce and stuff is it either goes really fast or it's not as high a quality as maybe you could find, you know, like here in Rapid City where there's lots of grocery stores to choose from. Over 50% of county residents live in a food desert. Low-income population, so they are defining that as a low-income population that resides more than 10 miles from a grocery store. So people in Lower Brule usually drive to either Pierre, which is about a little under 60 miles to get groceries, or they drive to Chamberlain, which is maybe 30 to 40 minutes depending on which way you take. We see a lot of people who are, you know, they don't have a vehicle, and so they're having to catch a ride with somebody and load up and maybe only grocery shop once or twice, which reduces their consumption of fresh fruits and vegetables. Lower Brule residents are challenged by various socioeconomic factors, and those affect their ability and need to live healthy. 39% of the residents of Lyman County, so this is not a reservation stat, this is a county-wide stat. 39% of the residents are below the federal poverty level, and 73% of the residents in Lyman County are eligible for free reduced price lunch, and 100% of the students that attend Lower Brule schools, so that's K through 12, 100% of them are eligible for free and reduced lunches. We have a lot of housing issues, as many tribal communities do. Overcrowding, high housing costs. Many have a lack of kitchen or plumbing facilities or appropriate kitchen and plumbing facilities. And research shows us that poor housing and neighborhood conditions contribute to poor health outcomes and poor access to physical activity and healthy foods. So I just wanted to give you guys an idea, like a picture of the community before I get into the actual implementation of the PSE tool. Okay. Oh man, I forgot I had all these pretty pictures. So these are some of the things I was just talking about. One thing I didn't talk about that we have that's a great support, this picture in the upper right-hand corner, we have this awesome sidewalk that goes from Lower Brule, which is, if you look kind of over the horizon of that hill there, that's Lower Brule, and then there's West Brule, which is behind where this photo is taken, and there is a beautiful path that goes from Lower Brule all the way up to West Brule, and it's lighted. So that's one really awesome support. The other pictures are just of stores throughout the community. That red store in the middle is our grocery store, our small grocery store. The left-hand side picture on the top there, that's a picture from our convenience store. We have the swimming pool there, and we have a couple, we have a few different parks in Lower Brule, but nothing up in West Brule. There's almost no recreational facilities for kids who live up in West Brule. And then that bottom picture is the healthy section from our local convenience store. Okay, so just like Jennifer told you guys, the first step is creating your tribal advisory committee. And I just wanted to give you guys an idea of, and this is useful even if you're just looking to create a wellness coalition, not just when you're implementing the PSE tool. But in the PSE tool, they recommend that you have somebody representing school and education, faith-based, workplace, healthcare, community at large, nonprofit, tribal leadership, youth, and elder. And when it came to school, we reached out to primary and secondary schools, the college, the preschool and Head Start, also the alternative school. And then we reached out to Chamberlain School and Lyman County School because we have many residents that attend those schools that are living in our community. As far as faith-based, we reached out to churches and anybody who had a general or advanced knowledge of traditional practices. So we didn't have any medicine men or women that were interested in being on our TAC, but we do have some elders from the community that have a wealth of spiritual knowledge to help guide some of the decisions. As far as workplace, we reached out to human resources professionals that work with the tribe, community of program or organization managers and directors, so people who were in charge of employees in the community. As far as healthcare, we had our IHS, or diabetes program. We have what's called a tribal health department, so that's like our CHRs, our elderly nutrition program, mental health, those kinds of things. And then local hospitals and clinics. So if somebody can't get to a hospital, or if the clinic is closed, then usually people have to go to Chamberlain Hospital or they have to go to Pier. And so, you can reach out to other hospitals as long as they have a stake in your community and are serving your community members, then it's useful to have them as part of your team. Community at large, our TAC was looking for just programs and services in the community that really are put there to serve everyone. So the EPO, the Environmental Protection Office, federal and tribal courts, so federal probation officers that serve the community members of Lower Brule, and then as well as like our tribal judge, our local prosecutor, those kinds of people. We have state and tribal social services that serve our community, and then NAHA and the community program, and we have one local bank, but many of our folks bank in Reliance, which is a local town, it is a border town, and Chamberlain. So we reached out to banks in those communities also. As far as nonprofit, our community specifically doesn't have a lot of nonprofit, but some of the, we have the reservation, the Crow Creek Sioux Tribe, which is just right across the river. They have some nonprofit organizations that serve our community. So we reached out to our local Boys and Girls Club in the community, and then the Women's Shelter, and an economic development organization that's across the river. I left the tribal leadership off, youth off, and an elder off, just because I feel like those are pretty self-explanatory. Tribal leadership, somebody who sits on your council, or non-unofficial leaders in the community, which is probably going to be served by one of these other listed professionals there, or community members. Youth and elder are pretty self-explanatory. So when it comes to recruiting, that part was one of the first things I did with this job, and one of the most challenging things that I did so far during my time. I started out with making phone calls, emails, and appointments with people that seemed to fit into the categories that that we were given. Some people that worked and other people it didn't, and it seemed that the most effective way for me to recruit people was to just show up at their office and have an elevator speech prepared and some kind of documentation that would explain to them that they could review later what their role would be as part of this team for the PSE tool, and in making decisions, what would they be doing. I think it was really, really important and crucial for me to make sure they knew what was in it for them. So how could this process help their organization? How would it benefit them? And it was discouraging at first, so I just had to be consistent and not give up and be flexible. So if that meant I had to sit outside of somebody's office for 20 or 30 minutes, then I just did. We were not ruthless, but we spent a lot of time tracking people down and just making sure that they knew we really wanted them to be a part of the process. A couple specific things that, like, for my community that we ran into that was hard was we didn't have, so at this point, we don't have any youth on our Wellness Coalition. During the school year, it's pretty easy to keep them coming consistently. But in the summer, most of the youth in our community are pretty transient. They're staying with grandparents, or they're not in the same location that they are during the school year. So we kind of lose them during the summertime, and then during the school year, we kind of have them back. And for us, tribal leadership was kind of a tough one too, because we're going through a lot of transitions as far as our tribal, the political transitions in our community. So there was a lot of inconsistencies and some political tension with the loss of our longtime chairman. And so that was just something that we just kind of rolled with, and we are looking forward to the new council this year and hopefully recruiting somebody and having somebody step up for that. So that's just what it looked like for Lower Brule. It might be different in different communities. There's no right or wrong way to do it, but that's just how we did it. When I say we, I mean a lot of me. And then once I got a few TAC members, then they were able to help me recruit some others. Another one, when it comes to like youth or elders, when I had a small TAC put together, I had them recommendations for people that they thought would be a good fit, because I'm from Lower Brule, but I don't live there, and they were mostly people who lived there and knew who would be a good fit. So listen to the community members. Okay, so the second step is data sources, and this is where you're collecting information about the community so that you can decide how you want to proceed and what kinds of changes need to be made in the community. And during this time, there are interviews that need to be completed, and they are directed toward community, organization, healthcare, schools, and work sites. And this was the list of each area that we came up with. And how I did that was was just one meeting. That was all that we did during that meeting. And it was kind of a popcorn conversation where I just said, okay, this is the definition of a community site. Who fits this? And so these were the specific ones that our community came up with. We had American Indian Institute for Innovation consultants in our community, and so they got thrown up there. Our local Circus of Care program, tribal courts, state social services, tribal social services. So these are, like I said before, organizations and people who serve the community as a whole. And organizations, those are all different organizations that contribute to our community. So the Boys and Girls Club, Lower Brule Community College, churches, Head Start, WIC, etc. And then healthcare, these are all the different healthcare organizations that serve our community: diabetes program, Lower Brule, IHS, substance abuse, Crow Creek IHS, just right across the river. They provide some services that Lower Brule doesn't, so we work with them a lot. The several different schools that serve our community, and some of the major work sites in the community. So the areas in the community where the most employees, that had the most employees, were under the work sites. And if there's any other like recent assessments that have been done within the community, we were blessed enough to have a health assessment that IHS had recently done to refer to, SDSU Extension had another assessment that they were in the process of doing too. So we got to take advantage of some of their data as well. And then we narrowed it down. So in this area, you really have to be flexible, because it would have been nice to have all of these people participate in the Eugene, can you hear me?
Whitney,
Am I cutting off?
you kind of cut out for a second, but you're back on now.
Okay. Okay. It told me my internet connection was unstable for a second there, but I think we got it. Okay.
Cool.
So it would have been really nice to have all of these organizations and folks representing all of these organizations participate in the interview process. But, you know, people are busy, especially leaders in communities like this, small communities that have a lot of needs. They're really busy people. So this is what we ended up narrowing it down to. And there's a couple different ways that I've seen it done so far. In some TACs, the TAC members are the ones who are helping doing the questionnaires. So they're going out to community organizations that they have connections to, and they're interviewing people. And some of it, the leader or the facilitator is doing those interviews. My TAC opted to have me do the interviewing. And then what I did was I brought back to them the information that I learned from these different resources, and they helped me kind of sift through it and make sense of it, and helped me, well, I helped them decide, we helped each other decide what was accurate and what did we think was just an opinion or those kinds of things. And then we cross-reference them with other resources like census data, CDC, those other assessments that I was talking about. And so we used both of those together to make sure we had an accurate picture of what the community looked like. Then step 3 is the ratings. So like I was just saying, I discussed interview results with the TAC, and we had to decide what, where we wanted, well, in the PSE tool, it's called a cut score. So we had to decide what we wanted to be the area, the place where if it was above this, then they were considered things that we didn't want to worry about right now. And if it was below this, then they were things that we thought were areas of need. So the cutoff score is not a pass or fail measure, but rather a point of prioritizing areas to focus on. So there's always ways to improve our communities, but for the purposes of this program, only so much could be taken on at one time. And the cutoff score was determined by the TAC, and that shows what is being called, what we called a community asset versus a need. The community, or the cutoff score for Lower Brule was 60%. So that meant we were calling assets, we were considering things that scored 60% or higher assets. And then anything that was below a 60% was just an area of focus for us. I guess you can think of it like I here, I'm just trying to think of it like where are the highest symptoms showing need and where are the lowest symptoms showing need, except for it'd be flipped around, I guess, for us. So the lower scoring ones were ones that we thought needed the most attention, and the higher scoring ones were the ones that we felt like were being addressed in other ways and we could hold off for now. I hope that makes sense. I remember when they first tried to explain this to me, I was like, I don't know, I'm confused. I don't know what you're talking about. until I actually did it. So I hope I explained it in a way that helps you understand it. The two areas that we decided to, we as a community and as the Tribal Advisory Committee, what they decided to focus on right now is chronic disease management and nutrition. So nutrition education specifically and local food sustainability planning. So the objective, the nutrition objective is to increase the number of people with access to environments with healthy food and beverage options. So like I said, Lower Brule doesn't really have much of a selection for grocery stores and access to healthy produce. So what we're doing is right now we're starting by just helping community members have a better understanding of what is nutritious, how to use it, and creating a palette for it. And then we're going to be working with local community leaders and tribal leaders to create a local food sustainability plan for the long term. And we're doing that nutrition education by implementing Harvest of the Month community-wide. So we're working with Head Start, the Boys and Girls Club, elementary, junior high, and high school, a local community garden that recently got started, and some other avenues. And Harvest of the Month is a really simple model. You provide some nutrition education about, say we're talking about tomatoes. So today the Harvest of the Month is tomatoes, and we're going to be explaining to whoever happens to be there. Maybe it's part of the elderly nutrition program. So we're talking to some of the elders in the community about why it's good for you. And then they get to try it raw. They get a recipe, and then they get to go home with some groceries and another recipe so that they can prepare it with their families. And then we have worked with SDSU Extension to provide, to help provide a community garden. And this is hopefully the first step in a farm to school program that they are looking to implement in the next school year. So not the 2016-2017 school year, but starting in 2017. So that's pretty exciting. SDSU Extension is also doing some gardening education in the community to help facilitate these efforts as well. And chronic disease prevention is going to be, or chronic disease management. So the objective there is to improve access to, coverage for, and utilization of community-based services for chronic disease prevention, risk reduction, and disease management by increasing the number of people with access to opportunities for chronic disease prevention, risk reduction, or management through clinical and community linkages. Sorry, that's kind of long. We're planning to do that by providing worksite wellness workshops, and the worksites get to help decide what topic they'd like to learn about. And we'll also be providing worksite wellness kits for each employee. So we're looking to have like pedometers in those, a cookbook, what are they called? Resistance bands, those kinds of things, with the hope that we can prove that they're useful to the tribal council and draft a policy that would allow work sites to have ongoing, at least annual worksite wellness promotional activities. So that's kind of what Lower Brule looks like. It's a lot of work and it's a lot of fun, and it really has so far helped empower community members, I think, because it doesn't just take the TAC to get these things done and to collect this information and share the knowledge. It really takes several community members, and it takes many community members to make the change as well. So if you guys have questions for us, now is that opportunity to ask them. Thank you.
Thank you, Whit and Jen. Awesome presentation. Like Whitney said, we'll open this up to any questions that anyone has. It looks as though Deverell in the chat has a question for Whitney. As soon as he sends it. What is the greatest impact of the TAC?
Oh my gosh. What is the greatest impact of the TAC? Like on the community or?
Or a contribution?
Okay. I think their expertise. Many of them are people who, so I don't know what it's like for your communities, but in our community in Lower Brule, we have a small community and lots of needs, and we have a really great core, maybe like 20 or so people in our community that are really involved in lots of great changes. And so most of them have been working towards the betterment of our community for several years. And so I think just their knowledge of what's been done, what our community members need or want, that's probably their greatest contribution. And I think they're making impacts every day just by the work that they do, and then they bring that knowledge to the TAC. So I think the beauty of the PSE tool is that the interventions, that the PSE interventions are really selected by the community as a representative of the community. They're not something that, like, the pitch team is coming in and saying, these are the things that we think need to be done here. But it's really that the community and the people who know the community best are deciding what we're going to be doing. Does that answer the question?
Yes. Well, I got a question, Whit and Jen. Well, more for Whitney. What would you consider whenever Jen was talking about traditional knowledge, empirical knowledge, or revealed knowledge? What would you say is, I guess, the impact for Laura Brule? Where would that fit within this traditional knowledge, empirical knowledge, or revealed?
I think for the PSE tool specifically, having those community elders, and although we don't have any traditional or political or tribal leaders on the TAC, I did spend lots of time with them during interviewing, and I think that there are a lot of PSE interventions out there that just don't address our community. And I think that having elders and people with that traditional knowledge a part of the decision-making process really ensures that we are choosing culturally tailored interventions. Like, for example, with the Harvest of the Month, we're not just going to be implementing the Harvest of the Month curriculum. We are going to be tying in traditional foods in with that, and traditional recipes, as well as some Lakota language concepts. The school is really excited and looking forward to tying those things in. And with the community garden, the same thing. They're really they're doing a lot of like local grasses and things like that as part of the gardening project. And so they're hoping to bring in some elders to create an education component. So I think just because we have community members making the decisions about how things are going to be played out, those things are tied right in there.
The more types of knowledge you can use, especially those 3 different types, the more information you're going to get about the community, the bigger the picture that you're going to see. And so the TAC is going to be able to pick out the best culturally tailored interventions that will be successful in the community, that will be sustainable, and that people will be able to have healthy lifestyles. So it's exciting to be able to incorporate other types of knowledge that fit better with different types of communities.
Yeah, and the beauty is just from reservation to reservation, or from, you know, from tribe to tribe, right here in South Dakota, the personality and the culture of that community is going to be different. I work with Lower Brule and Crow Creek, and somebody asked me, like, why don't they have one wellness coalition? They're right next to each other. Well, their needs and their personalities as a community are so different that it wouldn't make sense to have one wellness coalition. So, yeah.
We could start a forum.
Looks like, I don't know if you jumped into that question. Looks like Phil has a question. Do you have difficulties getting the TAC members to show up for the meetings?
Yes, I have created some, I don't know if I've created them, but I've picked up some tactics to get them there. So, one, we feed them, and that seems to help. And we really allowing them to select the time. So I recently started sending out doodle polls, and that seems to help because they're the ones who pick the time. Another thing that's been really useful, like I said, they're just really busy people because they're leaders in the community and they kind of have their finger in everything. And so we have a community champion that sits on our TAC that's kind of like, she helps me take notes, and when we're doing things, she hangs up posters and helps me recruit people to be a part of, the activities that we're doing. And one of her jobs is to call each TAC member the day before and remind them the meeting's tomorrow at this time. And this is one thing that seems to get them. We remind them we're eating. We need to know how many people are going to be there so we can make sure we have enough food or whatever. And sometimes it's just, like this last week we had bagels and parfait cups and orange juice, but we've done lunch for the whole thing too. So we've, and making sure that they know they're appreciated has helped getting them there. And making sure that their programs are benefiting from the project as well. So
I think if you can show how like Whitney said, their own personal program will benefit from these interventions and these strategies, sending out thank you cards, just a reminder of this is why we're doing it, and we really appreciate your help making the community healthier. Anything that you can do to almost create ownership is helpful.
Making sure that they have duties, like something that's assigned to them to accomplish by the next coalition meeting. Just letting them own the process. But yes, we do sometimes. So my coalition has like 10 consistent members over the last year, but most meetings only have 4, 5, 6 people at them. Another thing that's been useful is making sure that they know that they can delegate like one of their staff members to come, like the boys and girls, the Head Start. When the director can't make it, she sends her assistant. Or when the superintendent for the school can't make it, he sends one of the principals, those kinds of things. So if they can just have somebody there to represent their organization, then we tend to get more people there.
That seems to be the main question, or the main topic whenever trying to develop any kind of community action planning within the TAC, is how to get the TAC members there. So thanks for that, Whitney. Deverell asked Jennifer, what is a valuable experience you have learned about learned from working with these communities?
Well, from someone I can personally say not growing up in South Dakota, you learn that each tribe is different, and that Whitney essentially talked about this, but even tribes that are close in location, such as Lower Brule and Crow Creek, they're totally different in their needs. So that's been something that I've learned. And that's especially important when picking out interventions or trying to pass different policies. The steps working with one community in a tribe might not work in another community. So I think that's been very helpful to learn, and I've been able to witness that through working with 4 different tribes.
Any more questions? If not, I want to thank you, Whitney and Jennifer, for your awesome presentations on PSC tools. I know all of our tribes are trying to work on implementation within policy systems and environmental change. So a lot of very useful information that you've given us today. So I want to thank you for that. And if there is no more questions, I'd like to remind everyone to please click on the link and fill out the feedback form. And thanks everyone for joining.
Thank you.
Yeah.